Thank you very much for the introduction, and thank you very much for the invitation to come and speak to you this morning. I'm going to go through, really outline to you some of the work that's being done within WHO, but also beyond WHO on primary healthcare and the social determinants of health. And I'm going to refer to two reports that have come out under the WHO banner over the last year. One, Closing the Gap in a Generation, the final report of the Commission on Social Determinants of Health, and last year's World Health Report 2008 on primary healthcare. I'm just going to briefly discuss what these concepts mean, how they might relate to what you do and what you're interested in, and then also look at, well, how do we move from reports to action? What are some of the processes? What's happening at WHO, including this week at the World Health Assembly? Then my colleague, Dr. Adshead, will present on the non-communicable disease strategy, and I hope we can have a very robust and interesting discussion. And please feel free to ask or say whatever you want. That's what we're here for, to help you with your work and also to take any questions you might have. So, briefly, what do we mean when we talk about primary healthcare? Primary healthcare has a long tradition, but people often do have different understandings of it. And when we talk about primary healthcare in the World Health Report, when we talk about the renewal of primary healthcare, we're talking about the mobilization of forces in society, all of society, not just healthcare professionals, around an agenda of transformation of health systems and broader societal systems that are important for health, around these key values of equity, solidarity and participation. They were identified in the Declaration of Alma-Ata over 30 years ago as fundamental to health as a human right. And what we're really saying is we're asserting that these values are still fundamental today, that you need to structure healthcare services according to these values, but also you need to structure the whole of society if you really want to say that you're serious about people's right to health. Now, in the World Health Report, we're looking, if we say these values are important, we're looking at 4 key areas where we suggest some directions that we can move in terms of addressing health inequities, people-centred care, better public policies, and stronger leadership. Now, why, again, are we talking about a renewal of primary health care? And in summary, it's because things aren't working. Things aren't happening as they should. Firstly, we know that progress is not a given. So compared to 30 years ago when the Declaration of Alma-Ata said things that we think are still very relevant today, many things have improved, but many things haven't. Briefly, to give you an example, at the moment, about 9.2 million children under 5 die each year. Right? Now, there has been some improvement in child mortality. If children still died at the rate that they did in 1978, there'd be an additional 6 million child deaths every year. There'd be an additional 18,000 children dying every day. But the progress in countries has been very, very uneven. A country like Oman has reduced child mortality by 94% over the last 30 years, whereas in some countries there's been hardly any progress at all. And if the whole world had improved in the same way as the best performers, we'd save an additional 6 million children every year. And I suppose the argument is that there's no reason why we shouldn't be able to do that. I mean, of course there are explanations, but it's a failure to learn from what we know. It's a failure of policy. It's a failure of the way we structure our societies and the way we structure healthcare services. Reflecting that, even though average health may have improved in most places in the world, there are growing inequities between groups of people. So we see that both in rich countries and in poor countries. The gaps between the health status of different groups of people is increasing. And that's, if you believe in the right to health, simply unacceptable. There are new challenges: urbanisation, ageing populations, the chronic disease burden, climate change. There are new challenges today that we didn't have 30 years ago, but all of these new challenges really point to the need for a very comprehensive approach that draws on all of the resources we have in society, that draws on the expertise and knowledge of communities and people themselves in managing and constructing their own health, but still emphasises the strong role that governments and other key stakeholders have to ensure the right to health. And reflecting this, that there is this disconnect between the values that people have around health, the expectations they have that their needs will be addressed, that there will be equity, that it doesn't matter who you are, you're still going to get the care that you deserve, and the performance of health systems. That really, in many ways, whether you're in rich countries or in a poor country, people's expectations for their health and for health care aren't really being addressed. There's growing dissatisfaction for this. Before I came to WHO, I worked in China. And in China is a country that's seen huge reform in healthcare over the last 30 years, to the extent, unfortunately, that at the same time as there's been reductions in poverty and increased wealth, you've seen reduced coverage and reduced access to healthcare services. Now, there are 60,000 episodes of unrest a year in China, and many of those are related to people's discomfort and dissatisfaction with their inability to access health services. And it's not unique to China. If you go obviously to the United States, which many of you are familiar with, there's growing unease about the fact that almost 50 million people are not covered by health insurance and really lack effective access to healthcare services. In many of the poorest countries, there's growing dissatisfaction that even as we have huge amounts of new money, which may be addressed at single diseases, and that's very important, and we need to applaud that and build on that, that still many people with their basic needs aren't able to access services if they don't bear the right label, if they don't fit in the right box. And so, recognising this, there's a real need in this very complex environment for stronger leadership and steering. Now, in countries, healthcare systems are often fragmented. There's many different players. Now, there's often the government system, there's the private, both for-profit and non-profit. There's often donor-funded initiatives. It's very difficult to negotiate between these, ensure that they're all moving in the right direction. We face these same issues at the global level. There's no single global health player. There's a whole range of agencies that are involved in global health governance and global health policy. And that doesn't necessarily have to be a bad thing, but what it calls for is very strong leadership to coordinate between all of these different groups that all have a lot to contribute, but ensure that they're moving in the right direction to ensure that people have access to the healthcare services they need, and that they all contribute to building better and healthier public policies that promote and protect health. So, some of you may be a little bit sceptical and consider, well, primary healthcare, you've heard about this before. When we talk about primary healthcare, again, to reinforce the point, we're not talking about just the primary level of care. We're not talking about just a part of the health system. We're talking about an approach to the way you structure both healthcare, but also beyond the health sector, the way you structure your society to protect health. But some of you may be a bit sceptical and say, well, wasn't primary health care just about infectious disease or maternal and child health, or wasn't it just for poor countries, or wasn't it just cheap care, for poor quality care for poor people? We reject that. We think that if you look at the values and principles of Alma Ata, if you look at what we're saying, if we look at what countries are actually done in terms of primary health care, it's really about an approach that looks at what are the needs and how can we provide a comprehensive response for all people. It's relevant to all health threats, it's relevant to all countries, and we make the very strong point that primary health care is not cheap. It takes resources, it requires a complex approach, but that it's the best value for money in the way you use those resources. And so in the World Health Report, we focus on these 4 areas of reform to move towards these goals. Universal coverage reforms to improve health equity, service delivery reforms to make health systems people-centred, and I'll explain what I mean by that. Many of you may have some sense of that. Leadership reforms to make health authorities more reliable, and public policy reforms to promote and protect the health of communities. So, when we talk about universal coverage reforms and we talk about health inequities, we're really saying that there are lots of things that need to happen to reduce health inequities and to ensure that everyone can exercise their right to health.